The honourable member for Strathcona.
Thank you, Mr. Speaker. I rise today to move for second reading of Bill 46, the Gunshot and Stab Wound Mandatory Reporting Act. This bill is an important one because it will make our communities safer, as well as provide needed clarity to health practitioners. This legislation will make it mandatory for health practitioners to report gunshot and stab wounds. Similar legislation exists in Ontario, Saskatchewan, Nova Scotia, and Manitoba. Under the Health Information Act, healthcare practitioners, including physicians, nurses, and EMT paramedics, have the discretion to report gunshot or knife wounds in limited circumstances, but they are not required to do so. This Act will give health practitioners clarity regarding when disclosure of information is required and what information they should provide to police when individuals are treated for gunshot and stab wounds. Mr. Speaker, law enforcement is not seeking a carte blanche access to medical charts, files, or confidential doctor-patient information. The only information healthcare professionals will be asked to give is the name of the patient, the name of the facility, and the type of wound. In the case of EMT paramedics, they would have to give the same information and location of where the victim was treated if the person is not transported to hospital. This bill balances a patient's right of privacy of health information with law enforcement's need for information to help maintain public safety. Healthcare professionals are already self-regulated, so penalties for non-compliance with this Act are not necessary. Patient treatment will also be top priority for healthcare professionals. They would only make the disclosure to police as soon as they can without interfering with the patient's treatment or disrupting their activities. This legislation won't create extra paperwork for health facilities because the disclosure is to be made verbally. Unreported gunshot and stab wounds pose a public safety concern, and this bill identifies and addresses this important public safety matter. The information police receive as a result of this legislation will help police ensure that there isn't a threat of further violence and may even help prevent violence, injury, or death. Reporting gunshot and stab wounds may bring serious incidents to the attention of police sooner rather than later, so they can assess the threat and take the necessary steps to prevent further violence. By putting police in the position where they can check the situation out, they would also be able to alert other agencies if necessary. Likewise, police could protect the public in the case where the perpetrator returns to the scene or to the victim. This legislation supports our government's commitment to safer communities. Mr. Speaker, Albertans deserve to live, work, and raise their families in safe and secure communities, and Bill 46 is another step towards that goal. Thank you.